Hello, Miss Goolsby here. This is chapter 13. This is urine and other non-blood specimens and tests. The objectives are that we will discuss the different non-blood specimens and tests so that you will understand other things that come through the lab. We will also describe the collection, labeling, and handling for these non-blood specimens. When we're talking about non-blood specimens, common sense tells you that yes, it is anything that is not blood that is in the body. Blood is the specimen of choice for most lab tests, but lots of other substances in the body are also tested. The phlebotomist may be involved in obtaining these specimens. For example, you may be asked to do a throat swab collection for like a strep test. You may also be asked to do a sweat chloride collection. This is to test for cystic fibrosis, and if that's the case, you may be asked to help do the test. You may be asked to give instruction to a patient for urine collection. You will need to professionally tell whether it's a male or a female how to collect a urine sample. You may also be in the processing department to prepare any other kind of specimen for testing, or simply just the labeling and transporting. It's already been done for you, it's already been collected, and you're just getting it to the lab. So whether it be a liquid, a semi-liquid, or anything else that comes out of the body, any of these specimens have to be taken to the lab to the right department to be tested. You can even have tissue samples, hair and nail clippings, and even breath samples. When you talk about non-blood specimen labeling, this is up to on this slide. Proper labeling helps avoid any kind of testing delays that can compromise that patient care. Many body fluids are similar in appearance. They also include the type and or source of the specimen on the label, because just by looking at it, a lot of times if it is a synovial fluid or a pleural fluid or a pericardial fluid, if it doesn't say, then you don't have any way to know what kind of body fluid that is in that sample. If you are looking at your textbook on page 462, you will see in the key point on that page that phlebotomists are often asked to transport specimens to the lab that have already been collected by other healthcare personnel. And if you are asked to transport a specimen that you did not help collect, then you must verify that it is properly labeled before agreeing to transport it, because you need to be able to know that that is what is in that sample. This labeling part, it needs to be labeled with the same ID information as blood specimens. Although some of them have various other kinds of handling requirements, you've got to know what those handling requirements are, but they do need to have the same basic patient identification. The label should include the type and source of the specimen. It should also be applied to the container. That's important. Highlight, underlined. If you're taking notes, make sure you note that. The label should never be on the lid, because what happens is it goes to the lab, the lid is taken off to be tested, and then when the lid is laying over to the side, there is no label on the actual specimen itself. So that's a case where if you've got too many lids open, you may mislabel that specimen. Always make sure the label is actually on the container itself. You also must know the handling requirements of all these, and we will go through each one to protect the specimen integrity and ensure the accurate test results. You also need to keep in mind that just because it's not blood doesn't mean that it's not potentially infectious. Anything that comes out of a human body is potentially infectious, so treat every sample like it is potentially infectious. So standard precautions apply to everything. Okay, when we talk about non-blood POCT, which stands for Point of Care Tests, Quality Control. If it is a waived, non-instrumented POCT test that is performed without instruments, then these tests can be read visually. For example, you're going to read the color reaction on the reagent strip, and that color reaction, depending on what kind of test it is going to tell you the answer. So these visually read tests, a good example of this is you don't have an instrument, but your patient, say they collect a urine, then you can do these dipsticks, we call it. You dip this into the urine, you take it out, and you lay it down on a sterilized sheet of, paper that is specifically for that. You lay it down and you match up the colors with the colors on the bottle, and it tells you what that patient is positive for. So that's the reactions on that reagent strip that I'm talking about. Some of these have a daily liquid quality control that you have to do. You have to check it and make sure that those strips are working properly. Some of them have a daily one. Some of them have a per shift if you're in the hospital. It all depends on your facility's protocol that you would follow. But all of these control results must be recorded, because if they're not recorded and they are not done, then you can't ensure that your patient has good quality results. The first non-blood body fluid specimen that we're going to talk about is urine. Urine is the most frequently analyzed non-blood body fluid. It's readily available, easy to collect, and generally inexpensive to test. The analysis can aid in providing information on many of the body's major metabolic functions, monitoring wellness, diagnosis and treatment of UTIs or urinary tract infections, detecting and monitoring of metabolic disease, and determining the effectiveness or complications of therapy. So accuracy is going to depend on the collection method, the container used, how it was transported and handled, and the timeliness. Inpatient urine specimen is typically handled by the nursing personnel, and this means that the phlebotomist will just collect this as they go through the patient areas and take it to the lab. If you're working in the outpatient urine specimen collection, that's usually handled by the phlebotomist, because typically that's not a nurse that's down there. That's you drawing the patient's blood along with any other tests that they might be getting at the same time. So then that would be you handling that in the outpatient area. You need to be able to properly explain this urine collection procedure without embarrassing the patient. You need to use language adapted to the patient's level of understanding, and we're going to discuss that in a little bit for the verbal words that you're going to need to say. If it's an outpatient area, usually these instructions are posted on the wall in the restroom in the patient urine collection areas. But if it's not, and you just have to tell the patient, you need to be able to verbally instruct them as well as hand them some written instructions if your facility has that available. Okay, this is where I discussed this already, but here is a picture on figure 13.4. This is a figure that shows the urinalysis specimen collection kit. This is the container that they're going to obviously have the urine in. Then it is a transfer device, which is this yellow part right here. And then there is a preservative transport tube. So these come all together. This little kit comes all together. And this allows the patient to be able to go collect the sample. And then if you need to take anything out, you're going to take it out of that big specimen collection and put it into the tube and take it with you. Okay, the non-blood specimens of urine, the different kinds. Let's talk about those for a minute. Random urines, these can be collected at any time. Usually these are the most convenient type of specimen for patients. They're primarily used for a routine urinalysis and screening test. The next one is a first morning or 8-hour urine. This needs to be collected first thing after the patient has had preferably 8 hours of sleep. This is collected immediately when they wake up in the morning. This type of specimen typically has the best results for how their body is being able to break down substances. Fasting specimen, this is typically used for glucose monitoring, like for diabetic patients. It differs from a first morning specimen in that it is the second specimen voided after a period of fasting. Okay, so this is the second one. This helps ensure that the specimen will not be affected by food that was consumed before the fast. Then you have a timed specimen. This just means exactly what it says. It's collected at specific times. The first kind of time specimen is called a 2-hour postprandial specimen. This is collected 2 hours after a meal and tested for glucose. It's the primary way to monitor the insulin therapy of patients with diabetes mellitus. The 24-hour collection urine, this is a pooled urine specimen collected over a 24-hour period to allow quantitative analysis of a urine analyte. So usually they are given a large, wide-mouth container that holds several liters. This fits over the toilet and looks like an upside-down hat. That's what they collect the actual specimen in, is the upside-down hat. And then they take that upside-down hat and they pour it into the big jug that they get. And they have to refrigerate this jug in between. Because if they don't refrigerate this jug in between, then bacteria is going to just run rampant in it. Depending on what they're testing for, then this is going to contaminate the specimen. But the main thing that they're going to do for a 24-hour urine specimen is they're going to need to know what that patient's kidney function test is. And that is called a creatinine clearance. You need to know the name of that test. Creatinine clearance. Another test that is done this way is a liver function test, and they can test the patient for urobilinogen, which is the urine byproduct of the breakdown of bilirubin, and that's how they can get liver function tests done. Okay, another kind of test is a double voided specimen. This is one that requires emptying the bladder and then waiting a specific amount of time, usually around 30 minutes, before collecting the specimen. It's the most commonly used test for urine for glucose and ketones. So remember that. They empty the bladder, wait about 30 minutes, and collect the specimen. That's double voided. You don't collect the first one, but you do the second one. Okay, this is a picture that shows a slide that shows the 24-hour urine collection procedure. One big thing to remember when you're telling patients this, they always want to wake up in the morning and start this and actually void into the container for their first one. That's not how that works for the 24-hour urine. Step number 1, they are going to wake up, start the time for the 24-hour mark, but they're going to void into the toilet just like they always do when they wake up. And then they're going to note the date and time of starting on the container, but they're not going to void into the toilet anymore for 24 hours. So let's say they wake up at 8. If they wake up at 8 a.m., they void into the toilet, they start their time at 8, but that first specimen didn't go into the container, it went in the toilet. Then the next time they have to urinate, it goes into the container all the way up till 8 a.m. the next morning. So that's when they're going to collect every one of the urines in this jug for 24 hours. They're going to refrigerate the specimen throughout the collection period. Your slide says if required, because if for whatever reason they are not required to refrigerate it, then they can just leave it in the bathroom if bacteria multiplying is not a problem with that particular specimen. It depends on what the doctor has ordered. They're going to collect the urine before an anticipated bowel movement, not after, because you don't want to be having a bowel movement and then urinate, because that could, and it not be in the container because you've missed one of those specimens. So you want to always collect the urine before you're going to have a bowel movement. Drink normal amount of fluids unless instructed otherwise, and then void one last time right at 8 a.m. the next morning. Seal the container, place it in the cooler, transport it to the lab, and that is a complete 24-hour specimen. This is a picture of what that specimen container could possibly look like. They can be different sizes, shapes, and so on. But the one that is orange colored, that is your urine collection container. The one that is clear, looks like an upside down hat, that is the actual urine collection thing. It fits over the toilet. And then do you see where at the top of that picture it says acetic acid? Depending on what your doctor has ordered, your specimen container may or may not have a preservative in it. If it has a preservative in it, it can be a chemical, and you don't, like if a patient is collecting their samples, you want to make sure and tell them if their sample container has a preservative in it, that they not urinate directly into the container, because if it splashes back on them, then that's going to be a possible acid that is going to splash back on the patient. So make sure they know not to urinate into the container, but urinate into the collection hat and then pour that into the container. Okay, here are some other kinds of urines that can be collected. So we just talked about the 24-hour. The first one here is called a regular voided. There's no special patient preparation. You are handing the patient a container. They go to the bathroom and they void into the chemically clean urine container. So there is no chemical in this little cup. Then there is a midstream specimen. This is performed to obtain a specimen that is generally free of genital secretions, pubic hair, and bacteria that normally surround the urinary opening. So to collect a midstream specimen, the patient voids the initial urine flow into the toilet. So they start urinating in the toilet. And this initial flow helps flush any contaminants from their urinary tract. And then you bring the container into the urine flow. You collect a little bit of it, and then you take it out of the urine flow until the last of the urine flow is then voided into the toilet. So you're only catching the middle of the flow, and that's it. Okay, another kind is the midstream clean catch specimen. So you're going to collect it the same way. Start the stream, get in there and catch it, and then the rest of it goes in the toilet. But there is a step you do first for a clean catch. Usually you're collecting this one if they suspect that you have a urinary tract infection, and they might go ahead then and send that specimen for culture and sensitivity. That means it goes to micro to grow out the organism that is causing the infection and do antibiotic susceptibility testing. So you're going to need the same things, like you're going to need it free of any contaminating matter. But in this case, you're going to be a little extra careful. You're going to take a special little cleaning wipe, and you're going to wipe the genital area before the specimen is collected. And then this is going to ensure that there is nothing in that area that is going to get into the cup. So a phlebotomist must be able to explain that procedure to both men and women in the collecting methods. So this procedure that we're going to look at, you're going to need to look at your textbook on procedure 13.2. It is on page 467. This is a step-by-step guide to instruct the patient in how to collect the clean catch using the vaginal cleaning method. So if you will skim down to step number 3, it says stand in a squatting position over the toilet. Step 4, separate the folds of skin around the urinary opening with thumb and forefinger. Step 5, use the special wipes to clean each side and down the middle, using a fresh wipe for each area and wiping from front to back. Discard the used wipes in the trash. While keeping the skin folds separated, void into the toilet for a few seconds. Then, touching only the outside of the container, bring it into the stream midstream, and then take it out and void anything else into the toilet. And then you just get rid of everything else the normal way. But that is one way for the female. Look over on page 468, procedure 13.3. This is the clean catch urine specimen method for a male. So if you skim down to number 3, retract the foreskin if applicable. Wash the end of the penis with the special wipe or soapy water, beginning at the urethral opening and working away from it in a circular motion. Repeat the procedure with a clean wipe, keeping the foreskin retracted if applicable. Void into the toilet for a few seconds. Collect midstream. The rest goes in the toilet, and then they put the top on the lid and so on. You've got to be able to explain this procedure to a patient in their terms. Okay, so that's step by step how you do that. Let's look at the next kind of method. This is catheterized. Catheterized is collected from a sterile catheter that's inserted through the urethra into the bladder. So if a patient has a catheter, then the nursing personnel, they will be the one that collect these samples. And so you will just have the actual sample to pick up if it's an inpatient. The next kind is called a suprapubic aspiration. This one is where a needle is inserted directly into the bladder and it's aspirated out. The urine specimen, if it is done with a needle and syringe, is only going to be performed with the use of anesthesia and performed by a physician. So nursing nor phlebotomy collects this. You will just collect the sample and take it back to the lab. The last specimen is the pediatric specimen. This one is done in a plastic urine collection bag. It's if it's an infant or a small child who's not yet potty trained, then your patient's genital area is cleaned and dried before the bag is then taped to the skin. So the bag is placed around the vagina or over the penis, and then a diaper can be put over that collection bag so the baby doesn't pull it off. And then they're checked every 15 minutes until you have enough specimen. The bag is then removed, sealed, or the urine is poured into a sterile container, and then it's labeled and sent to the lab. Common urine test. The most requested urine test is a routine urinalysis. This one screens for urinary and systemic disorders. It is the most performed point of care test. Okay, sometimes it can be done as part of a patient's physical exam or various times throughout their stay in the hospital. But it can be ordered as part of that physical or any time during their hospitalization. This includes the physical components, looking at it, seeing what color it is. Is it clear? Is it colored? Is it cloudy? As well as the chemical and microscopic analysis, like using the dipstick that I was talking about. You want to avoid contamination by using a midstream collection if your patient has this. collected in a clear, dry, chemically clean, just regular urine cup. And you can keep this at room temp for up to 2 hours. If it's anything past that, it needs to be refrigerated. Okay, this is a picture of what is included in the routine urinalysis. The macroscopic part, that is the part that is done not under the microscope. So this is the physical part, meaning tell me what color it is it hazy, is it cloudy, is it clear? And then the chemical part is the dipstick. So reading, see how that stick is laying on that napkin? You match those colors up with that color on the barcode on that dipstick container, and you tell what's positive for each one. If your patient needs it, then they're going to have this conical tube, which is right there in that tube holder, and you're going to spin that urine down, and you're going to look at a microscopic examination of the urine. That has to be done under the microscope. So macroscopic is anything you can do outside of the microscope, and then microscopic is when you have to look at it under the microscope. Okay, culture and sensitivity. This is ordered for patients with symptoms of UTI. You place a measured, portion of the urine on a special like petri dish that has this medium in it. You're going to then, this will be done in the micro department. They put it in an incubator. They incubate it for 18 to 24 hours. They check it for growth. If anything grows, you identify the organisms that grow. Then they can do a sensitivity test to see what antibiotics work best on that organism. But this requires not just a midstream, but a midstream clean catch specimen, and it has to be a sterile collection container. So that urine container has to be sterile. It can't be just for a routine urine that is non-sterile. Okay, urine cytology studies. Cytology is a different part of the lab. This is the part that is, they have cytology and histology both in the lab. And this is detecting cancer, cytomegalovirus, and other diseases like viral or inflammatory diseases of the bladder or the urinary system. So cells that are shed during the urine process in that urinary tract, they can then be spun down and looked at on a smear, on a slide, and they can be stained by a method called the PAP method. This is the Papanicolaou method, and they can look for abnormal cells under the microscope. So you've got to have a fresh, clean catch specimen for that. And this specimen needs to be examined ASAP after collection, or you need to preserve it in alcohol. Okay, this is a sterile kit for urine that's for culture and sensitivity testing. So the patient, in this particular case, they can either void into the urine cup, or they can be collected by, they have a catheter. But that sterile cup, the little tube you see there does have a preservative in it. And so they're going to take part of the urine from that cup, put it in that tube, and that's going to be transported to the lab for the micro department for culture and sensitivity. So the specimen needs to either be refrigerated or preserved. This is a picture of the PD bags for the urine collection. So that's a picture of the bag that fits over the baby's genital area that collects the urine. Okay, urine drug screens. This is not just to detect recreational drugs, but also to monitor therapeutic drugs that patients might be on. So and when I skipped is the steroids, the anabolic steroids in sports. So this can be tested for that. But this is used to monitor therapeutic drug use, to minimize withdrawal symptoms, and confirm a diagnosis of drug overdose. Random samples can be used in chemically clean covered containers for this. Some common tests that are done, you can do urine alcohol or urine ethanol. These are not very good at evaluating intoxication, so they don't use these very often. They would rather do blood alcohols. Urine glucose and ketone testing. This screens for diabetes and ketones in a diabetic. Urine pregnancy testing. You need to know the name of the hormone, which is HCG. That's the hormone that does appear and show up positive in a urine pregnancy test. If a female is getting a urine pregnancy test done, this is best if it is the first morning specimen because it's a higher concentration of that HCG hormone in a first morning specimen. Some other tests that can be done are heavy metals. You can test for copper and lead, myoglobin, creatinine clearance, and porphyrins. Look at the little blue box on this slide. HCG can also appear, so you think about it being the pregnancy hormone, but it can also appear in the urine of patients with melanoma, tumors of the ovaries or the testes, and also certain types of cancer like breast cancer, lung cancer, and kidney cancer. They can show up positive for this HCG. Okay, let's move past urine now and talk about other fluids. One is amniotic fluid. This is the clear fluid that fills the membrane that surrounds and cushions a fetus in the uterus. If they are going to have an amniotic fluid drawn, it needs to be collected after 15 weeks of gestation and obtained by a doctor using a procedure called a transabdominal amniocentesis. That's the method. This is where a needle, it's guided by ultrasound, and the needle is inserted into the mother's abdominal wall into the uterus. About 10 milliliters of fluid from the amniotic sac is aspirated. It is analyzed to detect genetic disorders and problems in fetal development, and it must be collected in a sterile container, protected from light, and taken to the lab ASAP. Okay, spinal fluid. This is a clear, colorless liquid that surrounds the brain and the spinal cord. This is collected only by the doctor through lumbar puncture. It is used to diagnose meningitis, brain abscesses, central nervous system cancer, and multiple sclerosis. The doctor will collect a series of 4 tubes when they do this. Normally, the first tube is used for chemistry and immunology. The second tube is used for microbiology. The third tube is used for cell count and differentials in the hematology area, because it is the least likely to be contaminated with blood cells. And then the fourth tube is typically used for cytology or just as an extra tube. Okay, gastric fluid. Gastric fluid is stomach fluid, so it's going to examine the contents of the stomach for anything abnormal. Phlebotomists only assist in this analysis. The tube is passed through the mouth and the throat into the stomach after fasting. A sample of the gastric fluid is aspirated. It is tested to determine acidity prior to stimulation. The stimulant is then administered by IV, and you collect several more samples at timed intervals. Okay, nasopharyngeal secretions. This is from the nasal cavity and the pharynx. These can be cultured to detect the presence of organisms causing diphtheria, meningitis, pertussis or whooping cough, and pneumonia. These are collected using sterile Dacron or cotton-tipped flexible wire swabs. The swab is inserted into the nose and passed into the nasopharynx. It is rotated, removed, and put in a sterile container labeled and sent to the lab. These became extremely popular with all of the COVID testing once that virus appeared. This is a picture of the nasopharyngeal swab collection procedure. The patient's head should be angled for the proper collection, so you angle it back like 70 degrees. Using that swab, you grasp the shaft using the thumb and forefinger about 3 inches from the tip. Gently insert the swab into one nostril, stopping when the swab contacts the mid portion of the inferior turbinate. Gently rotate it to loosen up and collect the material. Gently withdraw the swab, put it in the viral transport medium, refrigerate it, and send it to the lab. And typically you have 2 swabs, and if you do 2 swabs, then there's a double chance that you surely would have collected it correctly. Okay. Let me look at something. Okay, saliva. Saliva is secreted by the glands in our mouth. You test saliva to monitor people's hormone levels or to detect alcohol or drug abuse. You can collect it very quickly and non-invasively, so it's very easy to do. You can do a point of care test on things to find this out. Sperm. Sperm containing fluid discharged during male ejaculation can be collected. It's analyzed to assess fertility or effectiveness of sterilization if they've had a vasectomy. It is examined also for forensic reasons in criminal sexual investigations or criminal assault. It is collected in sterile containers. You have to keep it warm and protect it from light and get it to the lab immediately. Serous fluid. This is a pale yellow watery fluid found between the double membranes that enclose the pleural, pericardial, and peritoneal cavities. It lubricates the membranes that allow them to slide past one another with minimal friction. Any of these can be collected by a physician. They are aspirated with a needle and syringe. You need to know if it says one of these fluids, you need to know what body part this came with. So pleural fluid is in the lungs. Peritoneal fluid is in the abdominal cavity. And then pericardial fluid is in the heart, or the area around the heart. Sputum. This is mucus or phlegm that is ejected from the trachea, bronchi, and lungs. It is collected for diagnosis or monitoring of lower respiratory tract infections like TB. First morning specimens are preferred due to larger volume that you can cough up. These are collected at least 1 hour after a meal to avoid gagging or vomiting up part of that meal. The patient is going to remove their dentures and gargle with water. The patient takes 3 to 4 deep breaths, then coughs forcefully, expelling that sputum into a container. And this next slide shows you what that specimen collection container can look like. A is a picture, the one at the top of the specimen collection container. B is a sterile collection kit. So it also has the biohazard bag on it. Another non-blood specimen is sweat. You analyze sweat for chloride to help diagnose patients with cystic fibrosis. It's called the sweat chloride test. The name of the drug that they use to induce the sweating is called pilocarpine. Pilocarpine is the sweat-stimulating drug that is transported into the skin by iontophoresis. That procedure is like a little bitty electrical stimulation. Once that patient sweats, it's collected, weighed, and analyzed for chloride. You can also use sweat to detect illicit drug use, and that is collected through skin patches. Synovial fluid. This is our joint fluid. Okay, it is normally a clear, pale yellow viscous fluid that lubricates our joints. Normally it is in small amounts, but if patients have inflammation around their joints, it'll increase. It is tested to identify or differentiate arthritis, gout, and other inflammatory conditions. It's typically collected in 3 tubes by a doctor because they're going to use a needle and syringe. EDTA or heparin, this is for cell counts, identification of crystals, and smear prep. A sterile container, which is for culture and sensitivity if they suspect the patient has a bacterial infection in the joint. And then a non-additive tube, which is for the macroscopic appearance, chemistry, and immunology, and to observe any kind of clot formation. Bone marrow. This is examined and aspirated to detect and identify blood diseases. The doctor will insert a very large gauge needle into the bone marrow in the hip bone or the sternum. They take 1 to 1.5 milliliters of the specimen, aspirated into a syringe, and they are going to take this specimen and make slides out of it. And these slides are then stained. They're fixed with methanol and then stained with a right stain in the hematology department, and then used for evaluation for the patient. Okay, you can also do breath samples. These are collected and analyzed. One is called the C-urea breath test. This is a common test to detect H. pylori. H. pylori is the organism that produces urease and causes stomach ulcers. The next one is called a hydrogen breath test. This measures the amount of hydrogen exhaled to help identify problems with the digestion of carbohydrates such as lactose and fructose. It is thought to be the most accurate lactose tolerance test, and it can also be used to detect bacterial overgrowth in the small intestine. Buccal or oral specimens. The collection of a cheek or a buccal or buccal swab. This can be used to obtain cells for DNA analysis. The phlebotomist will gently massage the mouth on the inside of the cheek with the swab. DNA in the lab is then extracted from the cells on the swab. This is mainly done for paternity or parental testing. Another sample is the cervical smear or the Pap test. This is the most successful cancer screening technique in history. It's named after Dr. George Papanicolaou, which is the test for cervical cancer in women. Cells are brushed or swabbed from the cervix, examined by a cytologist to detect abnormal cells. Feces or stool. This is used to evaluate gastrointestinal disorders. You can also evaluate the patient for parasites and their eggs. You can check that specimen for fat or urobilinogen content. You can culture it to see if there is a pathogenic bacteria that is actually causing a problem. And you can test them for occult blood using the Guaiac test. This is a picture of a stool specimen collection kit. This is a picture of a parasitology container. This has preservatives in it that are going to preserve the parasites in their eggs for the ova and parasite testing. Okay, another type test is the culture independent diagnostic test. This is abbreviated CIDT. This is used to diagnose foodborne illnesses. It detects the antigen or the genetic sequence of a microbe and has faster turnaround times than traditional cultures. The fecal occult blood test. This detects occult or hidden blood. It could be from cancer, like colon cancer, or just from the fact that there is blood there, like bleeding, and that bleeding can be from diverticulitis, gastric ulcers, ulcerative colitis, and polyps, or it could just be that they have hemorrhoids that are bleeding. Guaiac is the name that is from the resin of a guaiacum tree, and it detects blood in the upper or lower digestive tracts. The FIT is the fecal immunochemical test, and it detects the globin portion of human blood. So this one indicates colon or rectal bleeding because globin does not survive passage through the digestive tract. Hair, this can be collected to detect alcohol and drugs of abuse like amphetamines, opium, cocaine, or marijuana. Hair can also be used to identify poisoning by heavy metals like lead and mercury, as well as for DNA analysis. It's easy to obtain, less invasive, and cannot easily be altered or tampered with. But because you're testing for those kind of things, you will use chain of custody procedures if it's required for that particular patient. Nail clippings. Nail clippings grow slow and can be used for heavy metal testing as well as hair that can be done that way. Skin pricks. This is to test for like allergies. I don't know if anybody's had allergy testing, but they can check for allergic reactions to as many as 40 different things at one time. TB is also a skin test, tuberculin skin test. This is where every one of you have had this done for your TB skin test. Antigen is injected under the skin to make that red wheal or bump, and then you give it 48 hours and see if it gets bigger, 48 to 72 hours, and read it. Have it read to see if it got bigger. Throat swabs. These are collected to aid in the diagnosis of strep infections. Nurses will collect from inpatients and phlebotomists will collect from outpatients. But it's a sterile polyester swab with a transport tube, so you swab the back of their throat. This next slide is a picture. Hold their tongue down with a tongue depressor, swab the back of their throat, put it back in the collection container, and send it to the lab. This is how you do the throat collection procedure. This is on page 492, procedure 13.8 in your textbook. Wash hands, put on your gloves, follow your policy in your facility. Open the container, remove the swab, stand back or to the side of the patient just in case they cough on you. Instruct the patient to tilt their head back and open their mouth. Direct light onto the back of the throat with a flashlight if you need to, but you probably don't need to. Depress the tongue, have the patient say, ah. Swab the tonsils, the back of the throat, the inflamed areas. You want to avoid the lips and the tongue. Maintain the tongue depressor position when you remove the swab, because if you move the tongue depressor first, their tongue may move and then swipe the swab that you just used. Place that swab in a transport tube in the medium. Close the top, label it, remove your gloves and sanitize your hands, and take it to the lab ASAP. Okay, tissue specimens. These come from biopsies and they can be sent to the lab for processing. Biopsy is when the doctor removes a tissue sample to examine it. These tissue samples arrive in the lab in formalin, which is a diluted kind of formaldehyde that preserves that tissue. They're then accessioned and sent to the proper department. And this finishes up chapter 13. If anyone has any questions, post them to Canvas and I will get to them. I will see you in the last chapter, which is chapter 14.